Next, a 20-year-old female coming to the emergency room after being beat by a horse. After the horse beat her, she was short of breath and she had some palpitations. And at the time when she came to the ER, in the ER, she had wide complex tachycardia. And eventually she needed cardioversion and she was admitted to the ICU. While hospitalized, she did have another episode of non-sustained VT. So they initiated beta block and ordered a cardiac MRI. So here is from the base, mid apex. You look at the left ventricle, there's preserved contractility, no regional motion. The size of the left ventricle is normal. But when you look at the right ventricle, it's quite abnormal. I have a little more clone down view on the short axis and fourth chamber or horizontal long axis. The right ventricle is bigger than the left ventricle, so you have a dilated right ventricle. If you look at the wall, it's thin, but also does not contract normally. If you see there are lobulations or irregularity, and there is areas of dyskinesis. So when the ventricle is contracting, these areas bulge out, and the ejection fraction is decreased. Actually, on the late enhancement, there is late Galilean enhancement of the right ventricular myocardium. So enlarged right ventricle, decreased function, wall motion abnormality. In this case, also delayed enhancement. We're dealing with arrhythmogenic right ventricular cardiomyopathy, previously dysplasia. It's one of the causes of sudden death in young patients. I don't know what the horse had to do with anything, but it was lucky that she got this diagnosis because of the horse, maybe. And it's pretty much fibrofatty deposition. There's a familial occurrence, although it has various penetrance. And they mostly present with arrhythmia, sudden death. Those are the criteria. If you notice, fat is not in the criteria, and also delayed enhancement is not in the criteria. It's mostly the size of the ventricle, the ejection fraction, but you have to have that abnormal wall motion abnormality, the dysynchrony or dyskinesis or akinesis of that RV wall.